So there's a different marker for each different cell type. I'm not going to belabor that, just to show you that two-page list that we use. And we put 4 different monoclonal antibodies in each test tube that contains these cells. So, for instance, I can tell, is this a T cell in that tube? Is it a helper cell? Is it an activated cell? Is it a memory cell? And only if you can get multiple characteristics can you be sure about what you're really measuring. These are 2 of our kids, twins. We have several twins now in our center, and we've never had a case where more than one family member has opsoclonus-myoclonus syndrome. So the data I'm going to show you have just been recently published. The one in neurology came out in May, and this one just came out in June. So this is just coming to the surface now. And what we're going to, this is maybe the most important slide of what I'm going to show you. This is what the normal situation would be. If you look in the spinal fluid at these lymphocytes, you're going to find mostly T cells, at least 90% or more. And of these T cells, these 2 types are going to be prominent, the CD4 helper inducer cell and the CD8 cytotoxic suppressor cell. The ratio between these 2 is about 3:1, very important. Then you'll have a small amount of other cell types. Here's the killer-like T cell. Here's the true killer cell. This is the B cell. And this is the gamma delta T cell, which is that unconventional T cell I mentioned. It doesn't have to obey the rules of protocol that the other T cells have to follow. Antigen has to be presented to these cells in a particular way. This cell can go and react to self-antigens on its own. Now watch what happens in opsoclonus-myoclonus syndrome. That's in the gray. We see that the CD4 helper cells are less. There's a little increase in the CD8 positive cells. This ratio is lower, and in fact, it's starting. We have patients where it's flipped, where they actually have lower amounts of helper cells than cytotoxic cells. That turns out to be very abnormal. In normal individuals, the brain protects this very precisely, no matter how old you are. We found no changes in either type of killer cell. There's a significant increase in B cells that got into the spinal fluid and in gamma delta T cells. This data is from 54 children. Now, at the time that this data went in for publication, we now have 108 children who have had the immunophenotyping, and the data still hold. This is a blow-up of the B cell picture. So in normal individuals, B cells are tightly regulated at less than 1% of all the other cells. But in OMS, the average was 4%. And in fact, we found some children up in 29%. Very abnormal. Now here's the surprise. If you look at the tumor, the children who don't have, no tumor was found, let's put it that way, versus the ones who did, and this is about 20 versus 16 kids, there wasn't anything significantly different between the 2 groups. And if you look at the kids who had gotten chemotherapy for their cancer, they didn't fare any better than ones who didn't in terms of this syndrome. Now we also looked at these same lymphocytes in blood, of course, and the disappointing news was that in blood you're missing the picture. That there is a reduction of helper cells in the blood, but the rest of the stuff you're going to miss. These are the ratios for the spinal fluid to the blood, and what you find out is that most of your B cells are in your blood, not in your brain, whereas most of the activated T cells, it's the other way around. And again, the tumor and no tumor group, not a bit of difference statistically. Well, let's ask the antibodies that have been described. But here you see some striking relationships. First of all, all the families who come to our center know that we videotape them. We translate that video into a number. And you're mild if you're 0 to 12 points, and severe if you're 25 to 36, and you're moderate if you're in between. And this is the number of kids in each of the groups. What you see with increasing neurologic severity compared to controls in this column, you can see the helper cells come down. But the gamma delta cells are going up. That's really nice and linear. The B cells go up, not in a linear manner, but there's certainly more in the most severe cases. And what about duration? Well, this is for B cells, the same graph I could show you for gamma delta cells. Early on is where most of the activity is, but it doesn't go down to normal even in the chronic ones. Now, these are chronic cases that still had problems. I'm not talking about kids who have recovered and are doing well. The ones who still have a problem still have B cells. We see some of them out beyond 10 years. And this immune problem has been smoldering. Well, you're going to lose brain function if the immune system is attacking your brain for 10 years, even if it's low grade. Well, let's look at T cell activation. These are two activation markers, DR for more long-term activation and CD25 for more acute activation. And we found a significant increase in activation in OMS. Now, our controls are neurologic controls. These are children who got TAPS for other neurologic problems not known to be autoimmune. But these aren't normal individuals. And I suspect that if we actually had totally normal children for comparison, that this number would be lower, making a bigger difference in the